the question for you. Should we treat more diabetes with cooking classes instead of insulin? What about treating high blood pressure with more sleep instead of more medicine? Should we treat loneliness with community? Pretty thought-provoking, right? It's why I booked my next guest months ago, and he said yes. I've been waiting to talk to Dr. Marty Makary, a highly respected surgeon and professor at Johns Hopkins, and he is here this morning to answer my question. Doctor, finally, I've been waiting to have you on the show for months. It's so good to see you. I want to first talk about, that new book that you have, The Price We Pay. Why did you write it?
Well, look, our healthcare system is entirely broken, and we cannot rely on the government to fix it. We've got to start addressing the underlying causes of disease. As you mentioned, we've got to treat more back pain with physical therapy and ice instead of just surgery and opioids. Food is medicine. We've got to get at the environmental exposures that cause cancer instead of just throwing chemo at people. And there's a revolution now to get at these underlying issues, and that's exciting. And it's also to get at honest pricing. In America, businesses and healthcare have adopted this model of price gouging and predatory billing, and people are fighting back. So the book is about that revolution.
Yeah, the CDC now moving forward, talking about other things that you have been talking a lot about, holding this emergency meeting Friday, talking about heart inflammation in adolescents who have received a COVID vaccine. I have a son who has had COVID. I want to know, do you feel like what is going to come out of this meeting? And also, do you feel like we should be screening people and kids before they get a vaccine?
Well, first of all, if a child had COVID, natural immunity appears to be effective and durable. Those are studies that I summarized last week in the Wall Street Journal. So I would not recommend the vaccine for a child who's had COVID. For a child who's not had COVID, I would recommend one dose. If you're scheduled for that second dose this week, hold off. And let me be very clear about this. There are a series of complications that are clustered around that second dose that can be life-threatening. And the CDC is dragging their feet in classic bureaucratic fashion. They've held an emergency meeting. It's going to be held this Friday, 9 days after they knew about these complications.
Yeah, I think it's also interesting, too, that yesterday you tweeted that in your immunosuppressed patients, you do check antibody levels before, and I mean, after that second vaccine. In some cases, you would give somebody a third vaccine. Did I read that accurately?
Yeah, those who are immunosuppressed, and in our population, those who had an organ transplant, we do see a lower response to the vaccines. And in those patients, they may need a third dose or a booster in the future. I don't think the general public is going to need a booster. Natural immunity and vaccinated immunity appears to be lifelong. But for kids who are under age 30, I would recommend one dose. The effectiveness of that is extremely high.
And I want to know, too, then, locally here and nationally, you just talked about how you do test. Here locally and nationally, I keep being told that there is not a way to test, and I've had a test. My family's been tested. Is there, in your opinion, an accurate blood test to show if we do have immunity or not?
Yeah, so LabCorp and Quest offer an antibody test, and it can be specific to natural immunity or vaccinated immunity. People can go and have that test before they decide whether or not they have natural immunity and wwhether or not they need a dose of the vaccine.
Dr. Marty Makary, we're out of time, but again, we're going to have more information about that new book, talking about maybe really taking better care of ourselves, maybe helping in the long run. We'll link it on our website.